The invitation to the Morrison family reunion sat on my desk at Evergreen Healthcare Group's corporate office, its fancy calligraphy a stark contrast to the hospital's quarterly revenue reports I'd been reviewing. 5 years had passed since they'd banned me from family gatherings for being just a nurse, and now they had no idea I owned the hospital network their medical practices depended on. Miss Sarah Chen? My assistant appeared in the doorway. Dr. Morrison, your brother, is holding on line 1. Something about his surgical center's contract renewal. I smiled, thinking of David's last words to me at that disastrous family dinner. A nurse? God, Sarah, way to aim for the bottom of the medical hierarchy. Now his entire practice hinged on maintaining privileges at my hospitals, though he didn't know they were mine. Let him leave a message, I replied, straightening my Armani suit, a far cry from the scrubs I'd worn during my nursing years. I want to hear how he phrases his desperation. The view from my penthouse office stretched across downtown Boston, taking in 3 of the hospitals I now owned. When I'd started as a nurse at Massachusetts General, my family had treated my career choice as a personal insult to the Morrison medical dynasty. For generations of doctors, my father had declared at my nursing school graduation, which he'd barely deigned to attend. And you couldn't even make it through pre-med. What they never understood was that I hadn't settled for nursing, I had chosen it. Chosen to understand healthcare from the ground up, from the perspective of those who spent the most time with patients. And while they were busy looking down on me, I was building something they couldn't imagine. My phone buzzed, a text from my sister Elizabeth. Sarah, this is ridiculous. David needs that contract renewed. His whole practice depends on it. Of course it did. The Morrison Surgical Center, my brother's pride and joy, relied on admission privileges at Evergreen hospitals. Privileges that were up for review, with some concerning reports about patient care and staff treatment sitting in my inbox. Dr. Morrison's office is calling again, my assistant reported. He's becoming insistent. I picked up the latest incident report. 3 nurses had filed complaints about David's behavior in the OR. The same arrogant attitude he'd always had now affecting patient care. Tell him the CO will review his application personally, I replied, enjoying the irony. 5 years of hiding my identity as Evergreen's owner behind my grandmother's maiden name, Chen, was about to pay off. The family reunion was tomorrow night. They'd chosen one of Boston's finest restaurants, not knowing it was owned by my hospital group's hospitality division. Every detail of their gathering would be under my control. I opened my laptop, reviewing the guest list. All the Morrison doctors would be there, the cousins, uncles, and aunts who had nodded in agreement when my parents banned me from future family events. All of them depending in one way or another on privileges at my hospitals. Your mother called, my assistant added hesitantly. She wanted to confirm you received the invitation. Said something about hoping you've grown up enough to appreciate your family's position in medicine. I thought back to that last family dinner when everything had come to a head. I'd just finished my MBA, having worked full-time as a nurse while studying at night. Instead of congratulations, I'd received mockery. An MBA? David had laughed. What's next, trying to tell real doctors how to run their practices? At least she's trying to move up from being just a nurse, Elizabeth had added with fake sympathy. Though management is hardly the same as actually saving lives. That night, I'd gone back to my small apartment and finalized the paperwork for my first hospital acquisition. A struggling community hospital that the mighty Morrisons had overlooked, seeing only failure where I saw opportunity. 5 years later, that single hospital had grown into Evergreen Healthcare Group, 20 hospitals, 40 surgical centers, and a reputation for excellence in patient care. All run by the nurse they had dismissed. My phone buzzed again, another message from David. Sarah, stop ignoring me. This contract is crucial. I have surgeries scheduled next week. I opened his file, reviewing his history. Multiple complaints about demeaning behavior toward nursing staff. Several near misses in patient care that nurses had caught and corrected. All the same arrogance that had made him think being a doctor made him superior. Miss Chen. My assistant appeared again. The restaurant manager called. The Morrison party has requested the main dining room for tomorrow night. Shall I tell them you'll be attending? I smiled, thinking of the ID badge in my drawer, the one that listed my full name, Sarah Morrison Chen, CEO of Evergreen Healthcare Group. The one I'd been saving for just the right moment. Confirm my attendance, I replied. And make sure Dr. Catherine Wei is there. Dr. Wei, my hospital group's chief of surgery and a brilliant physician, had been my ally from the start. She understood what it meant to be underestimated, to be seen as less than because you didn't fit the traditional medical hierarchy. Should I prepare the contract termination papers for the Morrison Surgical Center? My assistant asked. Not yet, I answered, picking up the reunion invitation. Let's see how tomorrow night goes first. Sometimes the best treatment requires a proper diagnosis. I stood at my window watching the sunset paint the city in shades of gold. Somewhere out there my family was preparing for their reunion, ready to celebrate their medical dynasty. They had no idea that the nurse they had banned, the sister they had mocked, now held their careers in her hands. My phone lit up with one final message from my father this time. Sarah, your brother's practice is vital to this family's reputation. Whatever issues you're having with the contracts, remember blood is thicker than water. I thought about all the times they had chosen their medical hierarchy over family loyalty. All the times they had made it clear that being just a nurse made me less than them. You're right, Dad, I whispered to myself. Blood is thicker than water. But competence is thicker than both. Tomorrow night, they would learn exactly what just a nurse had become. And perhaps finally understand that sometimes the lowest rung on their precious hierarchy was actually the strongest foundation of all. The restaurant hummed with the quiet confidence of old money and medical prestige as I walked in, exactly 10 minutes after the Morrison family gathering had begun. Through the glass doors of the private dining room, I could see them all. The doctors who had looked down on just a nurse, now anxiously checking their phones for news about their hospital privileges. Miss Chen, the manager greeted me with a knowing smile. Your guests are waiting. I adjusted my Chanel suit worth more than most surgeons made in a month, and touched the ID badge in my pocket. 5 years of waiting, of building, of proving every dismissive comment wrong had led to this moment. Sarah. My mother's voice carried across the room as I entered. Why are you here? I smiled, noting how her eyes darted nervously to David, who was clutching his phone like a lifeline. I was invited, wasn't I? Family reunion and all. But you're not. Elizabeth started, then caught herself. We thought you were too busy with your nursing. Actually, I replied, taking my seat at the head of the table, a position that clearly irritated my father. I'm here on business. Evergreen Healthcare Group business. The room fell silent. Every Morrison doctor present knew that name, the rapidly growing hospital network that controlled their practices, their privileges, their professional futures. You work for Evergreen? David asked, his voice strained. Before I could answer, the restaurant doors opened again. Dr. Catherine Wei, chief of surgery for Evergreen Healthcare Group, walked in with purpose. Sorry I'm late, boss. Had to review some concerning surgical center reports. Boss. My father's wine glass froze halfway to his lips. I stood up, finally pulling out my ID badge. Allow me to properly introduce myself. Sarah Morrison Chen, CEO and owner of Evergreen Healthcare Group, including all 20 hospitals where this family currently holds privileges. The sound of shattering glass broke the stunned silence. Elizabeth had dropped her champagne flute. David's face had gone from red to white so quickly I considered offering medical assistance. This is impossible, my mother whispered. You're a nurse. Was a nurse, I corrected her. A damn good one. Good enough to see exactly what was wrong with our healthcare system. Good enough to build something better. Dr. Wei handed out folders to each Morrison doctor present. Your performance reviews, she explained with professional coolness. We've been particularly interested in your interactions with nursing staff. David frantically flipped through his file. These complaints. This can't be. 3 incidents of verbal abuse toward or nurses, I read from memory. 5 documented cases of ignoring nurse warnings about patient care. And 1 particularly interesting note about claiming procedures were routine, when nurses flagged serious concerns. You've been spying on us? Elizabeth's voice shook with indignation. No, Elizabeth. I've been doing my job, ensuring quality patient care across my hospital network. Something you might have noticed if you'd ever bothered to look up from your own sense of superiority. My father stood up, attempting to take control of the situation. Now see here, whatever game you're playing. This isn't a game, I cut him off. This is business. The business of healthcare that you all thought was beneath me because I chose to understand it from the ground up. Dr. Wei opened her tablet, displaying more data. Under Ms. Chen's leadership, Evergreen has the lowest complication rates in the region. Our nurse retention rate is triple the national average. And our patient satisfaction scores? Highest in the country. All because, I continued, we value every member of our healthcare team. Not just the ones with DR before their names. The reality of their situation was finally sinking in. Every Morrison doctor in the room depended on Evergreen hospitals for their livelihood. And they had just discovered that the nurse they had mocked owned it all. Your contract renewal, I addressed David directly, is pending review. Those incidents with the nursing staff? They're not just complaints anymore. They're policy violations. He slumped in his chair, the arrogance finally draining from his face. Sir, please. My practice will need to change, I finished for him. Dramatically. Starting with how you treat nurses. Elizabeth raised her hand like a chastened student. My cardiology privileges? Also under review. Though I was particularly interested in your comment last Christmas about nurses being glorified assistants. Care to explain that to Dr. Wei? The chief of surgery's expression could have frozen mercury. My mother tried a different approach, her voice honey-sweet with desperation. Darling, we're family. Surely we can discuss this privately. Family. I laughed softly. Like when you banned me from gatherings for being just a nurse? When you said I was embarrassing the Morrison medical legacy? I stood up, commanding the room in a way they had never thought possible from their nurse relative. Let me be clear. Your privileges at my hospitals are now contingent on complete behavioral reform. Any further incidents of nursing staff disrespect will result in immediate termination. You can't do this, my father protested weakly. The Morrison name means nothing compared to patient care, I finished. And if you doubt that, please try taking your surgeries to other hospitals. I'm sure you'll find plenty of options in Boston that aren't owned by Evergreen. The room fell silent again as they realized the truth. There weren't any other options. I had built my network carefully, strategically, while they were busy looking down their noses at my career choice. The new contracts are in your folders, Dr. Wei announced. Including the updated code of conduct regarding staff treatment. You have 48 hours to sign. And if we refuse? David asked, though his voice lacked conviction. I smiled, remembering his words from 5 years ago. Then I guess you'll have to find something else to do. Something more suited to your capabilities. The irony of throwing his own words back at him wasn't lost on anyone. As the reality of their situation sank in, my phone buzzed with a notification. Evergreen's stock had just hit another record high. The nurse they had dismissed was now worth more than the entire Morrison medical dynasty combined. One more thing, I added, reaching for my coat. The monthly mortality and morbidity meetings? They'll now be co-chaired by our nursing leadership. I expect full participation and respect from all attending physicians. This is revenge, Elizabeth accused, her voice breaking. No, I corrected her. This is healthcare reform. The fact that it feels like revenge? That's just a side effect. I walked out of the restaurant that night, leaving behind a family of doctors who had finally learned that hierarchy doesn't always flow in the direction they assumed. My phone kept buzzing with their messages, apologies, explanations, desperate attempts to salvage their privileges. 1 week later, I sat in my office reviewing the signed contracts. Every Morrison doctor had agreed to the new terms, their signatures proving that sometimes the best medicine is a strong dose of humility. Your brother's staff sent flowers, my assistant reported. Apparently he apologized to his entire team this morning. I smiled, touching the nursing pin I still kept on my desk. Sometimes the best teachers are the ones you refuse to learn from. Because in the end, being just a nurse had taught me everything I needed to know about running a healthcare empire. Including how to heal the sickness of medical arrogance, even if the treatment wasn't always comfortable for the patients. And as I looked out over my growing network of hospitals, I thought about all the nurses who would never again have to hear, just a nurse, from any Morrison doctor. Sometimes the best revenge isn't proving people wrong, it's changing the entire system they thought they controlled. After all, that's what good nurses do. We don't just treat symptoms. We cure the underlying condition.